Hello, everyone. Make sure my camera is on. Hello, everyone, and thank you for joining us, and welcome to the Level of Care Rate Determination Protocol webinar. We're excited everyone is here. I am going to wait just a couple minutes for a couple more people to log in. But while everybody is logging in, I just want to let everybody know that I did send an email out probably about an hour ago with the level of care matrix that is going to be helpful for today's webinar. So if you haven't checked your email and you didn't see it, please check your email right now while we're waiting for a couple more people to log in, because that's going to be very helpful throughout the webinar. But I will still send everybody the PowerPoint and all the materials that we go over in the webinar as well. So welcome everyone. Just a couple more minutes. So while we're still waiting, since we do have quite a bit of panelists today, I will go ahead and introduce everyone while we're still waiting for everyone to come in. My name is Jaylina. I do work for the Foster Caregiver Policy and Support Unit. I do have two of my colleagues from my unit, Jasmine Trailer, who is going to be controlling our PowerPoint today. My coworker Salima, who will be helping me with the Q&A portion of today's webinar. And then from our level of care unit that is going to be presenting for you all today, we have Ty Morgan, Kelly Walker, and John Hale. And our partners for the webinars from the California Alliance of Caregivers, we have Jen Rexroad, and Jackie. And I'm not even going to attempt to say your last name, Jackie. I should have asked before. But we also have Jackie with us today.
Braithizer.
Thank you. And then also joining us today is a former coworker, but very good friend. Her name is Lori Souza. She is a social worker / placement worker with Parents by Choice from Stockton, and she is going to be joining us today as well. So thank you everyone for joining us today, for participating as being a panelist. And let's get started. So I do want to remind everyone that this webinar is being recorded, and it will be on the Caregiver Support webinar webpage, as well as the California Alliance of Caregivers webinar page. And anybody who is participating today and wants a certificate of attendance for proof of participation, you can send that request to info@caregivers.org. We'll have that email for you guys as well. And then just also want to let everybody know that participants will not have the ability to speak in this webinar. So if you do have a question about anything that we're going over throughout this webinar, please use the Q&A section of the toolbar, which if you don't see the Q&A, there should be a little circle with 3 dots. If you click on that, you should be able to open up the Q&A. So here's the email right here for the certificate of attendance. Like I said earlier, everybody will have a copy of this presentation at the end of the webinar. So if you don't have anything to write with or jot this down, don't worry about it. I will send it to you in the follow-up email after the webinar. And so for today, the agenda is we do have Jennifer Rexroad from the California Alliance of Caregivers. She is going to be giving us the caregiver's perspective today. For the level of care presentation, we do have a tag team of Kelly Walker, Ty Morgan, and John Hale. Lori Souza will be giving us the social worker perspective, and at the very end, we will do a question and answer. So if you do have questions, like I said, just put it in the chat, the Q&A, and we will get those answered for you. Alrighty, I am going to pass it over to Jen, who is going to give us the caregiver perspective.
Welcome, everyone. Thank you so much for joining us this afternoon. We have a weighty topic for today's webinar, which is really exciting. There is a lot of information for you to use and digest, and we're really excited to bring all of this expertise to you. This subject of the level of care protocol may be new to caregivers, and it is a newer program or rate structure. And so we receive a lot of questions from all of you about what the level of care protocol is, what the assessment is, when is it completed, how often is it completed, if you receive any information, and so on. And so we are excited to bring this information to you to just demystify the process and to give you some information about due process. And we encourage you to ask questions and also to reach out to us after the webinar if you still need some more information or have questions. Like Jaylena said, we will be posting the webinar on our site and the slide deck, and we look forward to getting your questions and helping you out along the way, connecting you to more information. So thank you for joining us today.
Awesome. And next, we will get right into the presentation. So I will go ahead and hand it over to the level of care team.
Hi, my name is Ty Morgan. I'm the manager of the Rates Policy Unit, and level of care does fall within our purview. If you can go to the next slide, please. So today we're just going to do, we're going to have a little, our agenda here is to talk a little bit about the historical overview. And then we'll talk about eligibility, and then the LOC matrix domains. Then we'll bring up the static criteria and the static rate. Then next will be the intensive services foster care rate and program, and the LOC scoring sheet and completing the LOCP, leveling up, and then the due process, like Jen mentioned. But let's start with what is the LOCP. It is a strength-based rate methodology. It contains multiple questions. There are 5 different domains that are scored on a weighted point system, and it was designed to identify the services and supports that resource parents are providing to their non-minor dependents or children in their care. And then the rates are based on the services that the resource parent is providing to the child. And it is administered by the county social worker or your county probation officer. And then just a brief historical context. We did roll it out in a phased manner. So March 1st, 2018, we rolled it out only for foster family agency placements that started in care as of December 1st, 2017. We let it roll for a while and gathered some data as it was being implemented so that we could then develop further guidance to roll it out to all resource families. And then we did that on April 1st, 2021, and now all home-based family care settings are eligible for the LOC process. So the LOCP rate applies to the following, and it's approved relative caregivers in the ARC program, the Kinship Guardianship Assistance Payment Program guardians, approved resource families in both FFA and county approved homes. And hopefully we don't have too many of the next two since they're supposed to be phased out, but relative and non-relative extended family members and licensed foster family homes. It's also eligible for non-minor dependents who are residing in a home-based foster care setting, tribally approved homes, which are, like it says, homes that the tribe approves for their own children, and guardians where the guardianship was established in juvenile court. It does not apply to supervised independent living placements and transitional housing placements. If you haven't heard of those, those are for our older kids, usually 16 and above. They can live by themselves or they can live in sort of an apartment-like setting with someone there to help them out. Short-term residential therapeutic programs, non-related legal guardians that were established in probate court. So on the last slide, we said that non-related legal guardians are eligible, but those are the ones that are established in family court. So that's the difference. Emergency relative caregivers, those are basically resource families that haven't been approved yet. And it does not apply to shelters or unlicensed or unapproved homes. So hopefully this morning you got an email from Jalen with the matrix itself, but the LOC process is made up of the matrix, which is the 501, and the scoring sheet, which is the 500. The matrix is essentially a 17-page document full of things that a resource parent might do for a child and checkboxes next to it, and then points assigned to each section. So the social worker or probation officer would sit down and they're supposed to send a survey out to the foster parent, and then they would sit down and fill out what it is the foster parent is actually providing for the child. And then the scoring sheet adds it all up, basically. And the things that are in the matrix are 5 core domains. Those were developed to standardize expectations of what a resource parent would provide and related to the individualized care and supervision that a child or non-minor dependent needs. So the first domain of that matrix is the physical domain. And basically the RF meets the child's individual daily living needs like food and clothing and shelter and hygiene. But they also need to meet the needs for their community social functioning and extracurricular activities. And that includes teaching age-appropriate life skills, even when there are developmental delays. It does not include specific medical activities, which we'll talk about in a minute. And it also includes independence skills. The second domain is the behavioral and emotional. And in this one, the resource family engages to promote resilience and emotional well-being for the child or non-minor dependent, and encourages the child and non-minor dependent to engage in pro-social behavior. They should be participating in activities that are developing healthy relationships. And in this domain, if a child scores a 7 or, well, I guess you can't go above. If they score a 7, then the child or non-minor dependent would level up to ISFC, the Intensive Services Foster Care Program, which one of my colleagues is going to talk about in just a minute. The next domain is the educational domain. And in this one, the resource family should be promoting student achievement, fostering educational excellence. They should be seeking equal access to services for their children, and when required, response to suspensions and or expulsions. This domain does also include, children in early childhood education programs and youth that may attend adult programs. Fourth domain is the health domain, which we mentioned earlier. Obviously, this one, it's to promote health. So, things like arranging and facilitating healthcare, such as the CHDP wellness check, medical appointments, dental appointments, vision appointments, administrating medication. And if you have a special health care needs child, you should be monitoring, ensuring that they have access to the services that they need. And this domain also, if you get a rating, if the child gets a rating of 7, then it levels up to ISFC as well. And the last domain is permanency and family services. In this one, the resource family needs to promote or facilitate visitations, communication, the identification, development, and maintenance of lifelong support connections. Those connections can be with members of the biological or non-biological family and natural support systems. They also need to be connecting the youth with their community of origin, including connections with resources, cultural organizations, faith communities, and any other group that would develop a sense of belonging, identity, or a connection to their culture. And that's it for me today. And I'm going to hand it off to John Hale, who's going to talk about static criteria and intensive foster care.
Good afternoon. I'm John Hale, and I'm going to talk about static criteria and intensive services foster care. So the static criteria is a list of behaviors or conditions that indicate the need to provide a higher level of care prior to the use of the level of care protocol. The static criteria is used when circumstances indicate a need to secure a new placement or stabilize an existing placement for a youth with higher care and supervision needs. If the static criteria chronic indicators have been presenting within the last 12 months, the temporary static rate can be paid to compensate the caregiver for a higher level of care and supervision that they will be providing. The static rate is limited to 60 days with an additional 60 days extension as needed. This allows for time to complete the appropriate assessments needed for the level of care protocol assessment. And the extension of 60 days can be granted if more time is needed to conduct the level of care protocol assessment. If the county has sufficient information to conduct the level of care protocol, the county should be applying the appropriate level of care rates instead of using the static criteria. So essentially, if you have all the information to complete the level of care protocol, static shouldn't be used. Next slide, please. Okay. So this is the list of chronic indicators that warrant the use of static rates. These indicators suggest the youths may require a higher level of care and supervision, and the static rate can be paid while the county completes the level of care assessment. Simply having a history of one of these indicators doesn't necessarily qualify the youth for the static rate, because these indicators have to be present within the past 12 months. So, for example, if a youth has a history of substance use or abuse, but they haven't used or abused any substances in over a year, they wouldn't qualify for the static rate. Another example, if a youth has a history of habitual truancy from school, but they have maintained good attendance in school over the past year, the static rate shouldn't be used. Next slide. So there are some key points when it comes to the static rates. The static rate is paid while the static criteria applies. That will be the static rate. The static rate is the equivalent to the ISFC rate. And although the static rate and ISFC rate, that's intensive services, foster care, even though they are the same amount, they are considered separate, and they have different requirements to qualify for each rate. The use of the static rate is intended to last no more than 60 days for the purposes of completing the level of care protocol assessment. And the rate will also be effective retroactive to the date of placement. The static rate may be used to also stabilize the current placement. So if any of those chronic indicators arise, after the youth has, been maintained in the current placement for some time, and then one of the indicators arise, you could be eligible for the static rate. And an additional 60 days may be authorized by the county for the extension if there is more time that is needed for the level of care protocol assessment. Slide, please. So intensive services foster care. So the goal of the ISFC program is to ensure that youth in foster care receive the services they need in a home-based foster care setting, or to avoid or step down from congregate care, such as a short-term residential therapeutic program, an STRTP. The ISFC program requires specially trained resource parents with the professional and paraprofessional supports of an ISFC program. The county and the FFA, Foster Family Agency, are responsible for ensuring the child's or non-minor dependent's needs while they are in placement. Payment of the ISFC rate doesn't automatically categorize the resource family as an ISFC home. For example, if a youth is identified as being ISFC eligible and the resource family is willing to become an ISFC resource family, they can receive the ISFC rates before they are approved for being an ISFC resource family, to allow them to receive the rate while they complete ISFC training. And if a resource family chooses not to become an ISFC resource family, then the level of care 4 rate should be issued to the resource family. And that's if they choose not to become ISFC approved. Okay, next slide, please. Okay. So there are several conditions and or events that may occur that allow the ISFC rate to apply. The level of care score, or leveling up procedure. So a score of 7 in the behavioral, emotional, or the health domains will be leveled up to ISFC eligibility. An interagency placement committee, an ISFC rate may be paid as a result of a decision made by an IPC process. So an interagency placement committee, if you're not aware, is it's like a multidisciplinary team meeting. So you have probation, child welfare, you may have mental behavioral health, education, public health nurses. They may be present in this meeting, and they all discuss the child's conditions and circumstances and needs. And if they determine that an ISFC rate is needed, they can determine that the youth is eligible. And lastly, special health care needs. So a special health care needs eligible child or non-minor dependent that was receiving the static rate may become a permanent ISFC rates when the child or non-minor dependent's health conditions are severe or unlikely to change. Next slide, please. Training requirements. ISFC resource parents are required to complete 40 hours of pre-placement training. So in addition to the 12 hours of pre-approval resource family training that is completed during the RFA process, an ISFC resource parent also needs to complete an additional 28 hours of training. This training must include 18 hours of trauma-informed training and 10 hours of electives individualized for the child or non-minor dependent's needs. For example, a child may have medical needs or a history of commercial sexual exploitation or a history of delinquency. Training in these areas could meet the 10 hours of elective training requirement. ISFC resource parents must also complete ongoing annual training. So after a resource parent is approved for ISFC, there will need to be 12 hours of annual training that is individualized for the ISFC child or non-minor dependent's needs. Additionally, 12 hours of individualized training will need to be completed within 12 months after the initial placement of any ISFC child or non-minor dependents. Please note, additional training subject matter may be required by the county, depending on the particular needs of an eligible child. Okay. And I believe we're passing on to Kelly.
All right, thank you, John and Ty. My name's Kelly Walker, and I'll be rounding out the rest of our presentation, starting with completing the LOCP. So information that can be used to inform the LOCP rate determination can include various things such as court reports, screening assessments, the CANS assessment, a CFT plan, or notes about the child's needs. This information can take time to gather, so we ask that the LOCP be completed within 60 days of placement. In the event a child experiences multiple placements within the first 60 days of entering foster care, it can be difficult to complete an LOCP until the placement stabilizes. So in this instance, the basic rate would be paid until the LOC is completed, and the rate would be effective retroactive date until the date of the latest placement. If a child does happen to exit foster care in less than 30 days, the LOCP determination is not required for a short-term placement like that. So the basic rate would just be paid for those 30 days or under, whatever it may be. And lastly, all rate changes should be reflected in the SOS 154A FFA placement agreement or the SOS 156 foster parents agreement and become effective when the LOCP is completed. Next slide, please. So we do have 4 triggering events of the LOCP, and basically it's just a triggering event is just a word we would use for a time for the LOCP to be warranted. They are new entries into foster care, including reentry, placement changes, a request from a provider or resource family, or in the case of the ISFC rate being lowered. Next slide, please. So these are the effective dates of the LOCP of the 4 triggering events I just mentioned. So the basic level rate is to be paid until the LOCP is completed, unless the child has a static criteria indicator. And if they did have a static criteria indicator, they would then receive the static rate, which is what John went over earlier. So for new entries and placement changes, the LOC rate is effective retroactive date to the date of placement. And a resource family, you guys can also request a LOCP redetermination due to the increased or changing needs of your child. It could be additional transport to a medical appointment, extra night supervision, arranging extra educational supports. Any of those items mentioned in the LOCP matrix Ty spoke of, you can request a redetermination. So for this triggering event effective date, the rate would be retroactive to the date you as a resource family made that request for a new LOCP. And lastly, we have the ISFC rate. It is retroactive to the date of placement. However, in the event the ISFC rate is lowered, the effective date of that rate decrease is effective the first day of the month following the completion of the LOCP. Slide, please. I know this is probably hard to see. We have it linked at the end of this presentation. It's also available in our ACLs or always at the LOC mailbox. It is the SOC 500 LOC scoring form. This is what will be filled out by the social worker or probation officer. I'll just kind of walk you briefly through it. So section A, it's our static criteria section. If static criteria does apply, there's a drop-down box in the upper right. The social worker or probation officer would just select yes, and then on the drop box, and then check the applicable static indicator in the checkbox. If that is selected, then automatically section C would generate the static rate. However, if no static criteria apply, no would be selected in that drop-down box. And then we would move down to the box where it says core domains, which is section B. So this is where each score from each of the 5 core domains would be entered in. And then a total would be automatically generated, which corresponds to a rate. So whatever that total is, section C would then generate that rate. Slide. So in section C, there also is a leveling up guide of that scoring sheet. And so the leveling up guide, I believe was spoken about earlier, but I wanted to reiterate a score of a 5 in any domain levels the child up 1 level, and a rating of 7 in either the behavior or emotional domain or the health domain levels up the child to the ISFC. So due process, this is what we were asked to specifically cover, and hopefully we can cover that for you and questions at the end if needed. So due process rights for families are for whenever the initial rate is set, the rate is denied, there's a change in rate, a discontinued rate, and the LSCP rate is administered and the rate remains the same. So if there is no change in rate, there still is due process rights. Excuse me. It is a requirement for social workers and probation officers to share a completed copy of both the LOCP matrix and the scoring sheet to families. If the child does remain in the same placement and is receiving an LOC 2 through 4 rate, in no case shall that child's rate be lowered. So notice of action. A notice of action, or a NOAA in short, it provides an explanation to resource families of how and why the rates are set, changing, or was a request for an increase was denied. We did develop the NOAA NA 403 for county use. Substitutions of the form are not permitted. Adequate notice must be provided to a resource family whenever a rate is granted, increased, denied, decreased, suspended, canceled, discontinued, or terminated. And even if a rate determination results in no rate change in all, a NOAA still must be sent to families. Again, this may be hard to see, but I just wanted to include this to have you familiar with what you should be receiving from the county. This is the NA 403 that the department developed. This is a form counties are required to use and notify families explaining that their rate has been established. Again, this form is located on our department forms webpage. It's linked in our ACLs, and it's also linked in our resources slide at the end of the presentation below. This is the back page of the NOAA NA 403. It explains your hearing rights as a foster parent. So you would just fill out the back page describing why you're requesting a hearing, as it is your right to do so. You can ask for a hearing if you disagree with the county or agency action, decision, or failure to act. One item to note is that if you do want to request a hearing, you have 90 days starting the day after the date of this notice was issued to fill this out and turn this in. So 90 days to request a hearing from the date the NOAA was issued and sent to you. And that wraps up our portion so far.
This is Jack. Oh, Lori's gonna go. Never mind.
All right, everyone. Thank you, Kelly, Ty, and John. I know there's quite a bit of Q&A questions, so we will get to those right after the social worker perspective. So right now I want to introduce Lori Souza. She is a placement worker for Parents by Choice. Welcome, Lori.
Hi, everyone. Thank you. I am a placement worker and I have been a social worker for over 10 years. I used to do field social work and now I do placement, so I'm familiar with both sides. I think the protocol and process is when a county, at least for the FFAs, for our county homes, when a placement worker contacts you and they tell you about the child, they're doing what's called an intake, or they'll call it an intake, a referral, a PMI for placement matching intake. These are the things that they're either reading or emailing to you to tell you about the child. And generally, in most situations, the county placement worker should know what the LOC is. And the LOC can be anything from basic to level 2, 3, 4, and ISFC. ISFC being the highest. Level 2, 3, and 4 are determined by what other people have talked about in regard to the matrix and the children being assessed. So the process would be when the county worker contacts me, just like they would a county family, to tell me about the child, then I always ask, what is the LOC? Because the LOC will help me determine where the level of care is, but it also tells me how high the level of care may be for that child. I know if the child's ISFC that there's going to be a lot of behaviors and or medical needs. If the child's basic rate, then they're generally coming in with minimal behaviors, or they haven't been assessed yet because they're just coming into care. If they have level 2, 3, or 4, then they've already been assessed, and then I know what they're coming in at, and then I can ask the questions. Well, why are they a level 2? Why are they a level 3? Whatever that looks like. So that's my role as the placement worker, is to find out everything I can about the child up front so that I can be completely transparent with our families, and then also determine what the LOC is, because at the end of the day, the LOC is very important because it tells me kind of where that child is at. Are they coming in with minimal behaviors, extreme behaviors, lots of appointments, just a few appointments? Are they seeing one therapist a week? Do they have wraparound services? The LOC will kind of help determine all of that. Not to mention, the LOC also determines the rate of pay, the one thing nobody likes to talk about. Basic level is going to give you one rate of pay. Level 2, 3, and 4 will increase the pay. But what we also have to remember is the increase of pay also means that there's a higher role that the resource parents also play in the child's life. So there is a document that you can find on the licensing website. I have it right here, but you can look it up. It is called the Resource Family Reporting Tool. And again, that is on the licensing website. I can provide the link once I'm done here. But what this reporting tool does is it helps the foster parents and the county workers to do an assessment at home with the child, because the social workers spend a minimal amount with the children. Our families spend the most amount of time with our children. So we want your input. We want to know, where does this child stand? What have you done? What have they done? How can we help? And so what the assessment tool does, it's a 3-part tool. It asks the resource parent, how many ADL? So an ADL is an activity of daily living. So for example, the first question is, the child may need assistance with basic self-care tasks. These include feeding, toileting, bathing, bathing, grooming, other things. And then the next question is, how are you helping the child with these ADLs? And then it gives you some options. And then it says, how many do you assist with daily? And these numbers, and this goes along with the domains that we were talking about earlier, with each domain. And this helps the foster parents be part of the assessment. So you complete the resource tool, and then you should turn this into the third page, is a signature page. So you take the entire document, the 3 pages, and you give this to your county social worker. And at the third page, it has the resource parent signature and the social worker / probation officer signature. So both of you have signed this and have agreed that this is the assessment on the child. Then the county worker can take this tool back and put this information into the matrix to determine the numbers that determine the actual LOC of the child. And this allows the resource parents to be involved in the process of assessing the children. So it's not just the county social worker assessing the children, and it's not just the foster parent. This is kind of the accountability where the social worker signs the form that the foster parent fills out. And if they don't agree, then you work with it together. But this is a form that you work with your county social worker on, that you complete and give to them. And then once they have this, then they can take it to their office to be approved for the higher LOC if that's what's needed. If you come across this and you're like, well, he doesn't need all of these things, and it lowers, then like my previous person stated, then the following month on the first day, that's when the decrease is implemented, instead of in the middle of the month or whatever that looks like, because we know payments are different for FFAs as they are county. And so you can manage that. So it's not all hitting everybody at once. So the partnership with the resource family is really important, because we take these tools, and even as a FFA worker, I would go over this with a foster family. I would go over this with the foster family, and then if the county social worker is busy or they're not available, because we already know they're overstaffed and they're hard to get a hold of many times. But if, as a foster family agency worker, I can do this with the family and send it to the county social worker and then ask for a response on that. And I would certainly do that in writing. I would take the form and scan it and send it to them in writing, and then ask for them to review the assessment and then determine the LOC from there. And your children may be basic rate, which is great, right? We don't want kids with behaviors and issues and all of that. But the reality of foster care is together we're all seeing different things in different kiddos. So going over the reporting tool helps everyone to determine, where is this kiddo at? Where are we helping them? Where do they need us? Where are they developing on their own? So the importance of the reporting tool to determine the LOC is so that everybody is together on the same page. The county social worker, the resource parents, and the foster family agencies are working together to collaborate and determine what the LOC is. And so that it's not only helping everyone to determine where the child's at, it's adequately preparing resource families for what they're coming into with the children. What does that look like? So that's, to me, is the most important partnership, is with the LOC, is having the information on why is that child the LOC that they are, and obviously how can we help, where do we provide resources, and where do the resource parents provide resources, again, transportation or medical needs. Visits obviously aren't on here, but everything else that has to do with the child and how they're functioning, and determining the LOC and moving forward from there so that everybody's on the same page. So that would wrap it up for me.
Awesome. Thank you, Lori. Appreciate you being able to be here with us.
Daylena, do you
So
mind if
now
I
we
step
will
in for
move
just a
over to
moment?
the Q&A section.
Do you mind if I just step in for a moment? It's Jackie.
Go ahead.
Oh, I just wanted to say thank you very much to Lori. I thought that was a super, all of you guys, thank you so much for doing this and for Lori for explaining, you know, an FFA social workers participation or how they can help. I just wanted to mention that 75% of children and NMDs and youth in home-based homes are with relatives, approved relatives, and with county homes, and they don't have an FFA social worker. So it's really important that county social workers and probation officers have the information how they are supposed to be using this tool with the county approved home and the relative approved home, since that's where 75% of the kids are. The question I have is, I'm still not sure, and I was hoping maybe you guys can answer this. When does the county social worker and or the probation officer actually engage with the resource parent? When do they have to do it within 60 days, but do they have to show them the matrix, go over the static criteria, show them the forms and discuss it? Or can they do it by simply not letting them see the forms, getting the information by conversations, filling it out, and later, you know, of course, the notice of action and the due process, they are required to send the matrix, completed matrix, and the completed scoring sheet with the notice of action. But we know that that really isn't happening on a regular basis, and I think it's more because it's not clarified on the notice of action form that you send it. But could you please answer or help clarify for those social workers who are watching this or caregivers want to know, when do they get involved in the process and when do they see upfront the matrix and understand the process?
Sorry, Jackie, could you repeat the last part of that question? I was looking something up.
Yep, no problem. When does the, since 75% of the children are with county approved homes, non-relative, and then relatives, approved relatives, it's something like, I don't know, now it's like 19,000 kids are with relative homes, 9,000 are with FFA, 7,000 are with county homes. So the vast 75% are not with FFA. So FFAs, I think, do a really good job of understanding the LOCP. They have, you know, that knowledge based into their organizations. And I love that Lori kind of says, hey, we take it upon ourselves to go over and use this resource reporting tool. But we haven't seen that as much, and in some counties not at all, with the county home. So what would you tell the counties in terms of a county social worker or probation officer? When should they show the forms to the resource parent, knowing they have to complete it within 60 days? Or do they not have to show it to them and explain it and then just send them the, because now we know due process has nothing to do with appeals. Due process means every resource parent receives a completed matrix and a completed scoring sheet.
Yes.
But we also know that's not happening. So I'm saying, when would county social workers and probation officers, when would they show the forms before they fill them out themselves to the resource parent?
Well, when they sit down to, I mean, like the LOC, so during a child and family team, it could be brought up, but the LOCP is never to be conducted during a child and family team meeting. So it could be discussed, but when they sit down to do the LOCP, those forms should be sitting there in front of them and filling it out together. In addition to the other things I mentioned, screening assessments, court reports, it should be from the get-go. I do know a lot of counties do not use the resource family reporting tool. It's highly suggested. We never required it. I do think though that it could be beneficial because that kind of is almost a precursor, you know, for the family to know what to expect when the LOCP is being conducted during the child and family team meeting. It's just something that should be from the get-go.
So basically the answer would be the department should clarify for counties It's not an may, it's you shall show the resource parent the LOCP matrix and go over it with them and discuss it within that 60 days. You can't do it without showing it to them and informing them.
Yeah, and we'll
Correct.
have that in the facts when we get it out. It's just we don't have permission from execs yet.
Okay, well, thank you, Ty. Oh, and then I did have that one question to John. I really think it's important, and this will be, you guys are doing great. For ISFC, most counties do not have an approved ISFC program, but 2017-11 ACL page 8 authorizes a county to do an ongoing static criteria ISFC rate to a family, even if the county does not have an approved, state approved ISFC program. If the family, county home, is not within FFA, if they take specified training as designated by the county. So I just wanted to point that out, that it can go beyond the 120 days. If the LOCP or IPC says, yes, the child's ISFC, that there is an option for a family ISFC stipend.
Yes, correct. There is a family-only ISFC rate. And yes, that's, as you mentioned in your question in chat, that's ACL 1711, page 8, number 4. So yes, this rate can be used for counties that don't have ISFC programs. The intent isn't necessarily to compensate for counties not having a program. It's for to address specifically if there is a child, placed in a resource family, and the county can apply this rate if it's based on the intensive needs of the child, and the caregiver meets the specified training and competencies matched to the child's needs. That's a determination made by the county. And yeah, and it doesn't necessarily mean that the home is or is required to become ISFC approved. This is one of the circumstances in which you can receive the ISFC rate and not be an approved ISFC resource family. But yes, and it's, yeah, key point is that it's based on the intensive needs of the child. If the caregiver meets a level of specified training and competencies matched to the child's needs.
While we have a break too, somebody in the chat mentioned the NOAA, and then the NOAA should be going to the resource family. I'm not even sure if the FFA gets a copy, to be honest, but if you look at the form in our presentation, it says right on it, for resource parents. So it should be going to the resource parents.
Thank you. We do have a couple more questions. The next question is for the static criteria and the chronic indicator, how is it applied to the LOC process?
Well, those indicators are intended to be used like on a short-term basis. So these are indicators that identify a possible need for increased care and supervision. The real thorough assessment would be the level of care protocol, which would determine the appropriate rate or ISFC eligibility. The static rate is intended to secure or stabilize placement and provide the caregiver with the additional funding resources to secure or stabilize placement while the level of care protocol is completed. So those indicators are indicating a possible higher level of care. However, in order to know for sure, the level of care protocol would need to be completed.
And so to say that a little simpler, you would get the static rate right away while they were doing the LOC. So they don't necessarily go together. One is sort of a placeholder until the formal one can get done.
Awesome, thank you. Another question we had was, when should an LOCP be conducted?
So that was, I mentioned at the beginning, it's a triggering event. That's what we call it. And so any of those 4 events that I listed in the beginning. So it was a new entry into foster care or reentry, a placement change, a request from the provider or resource family. What was the last one? Oh, and the lowering of the ISFC rate.
Perfect, thank you. Is there a timeline for the counties to complete the LOCP?
In 60
it-
days
it should
of
be
one of those triggering events.
Correct.
Or when does the LOCP rate take an effect after it is completed? How long does it take?
Well, it depends on which one of those triggering events. So basically it's retroactive to the date of placement. One of the different effective dates would be as if the resource family requests the LOCP. The effective date is the date that parent requests it. So the other ones are at time of placement. Resource family request is at the date of the request.
If you're asking how long it takes a county to process that, though, that's
Yeah,
an
that's
individual thing up to the
yeah.
county. So we don't really dictate that.
Thank you. The next question, how long can an ISFC rate be in effect if the county approved resource parent is not an approved ISFC resource parent?
If you're not a ISFC resource parent, and we're not discussing the family only rates as we mentioned earlier, you can receive the ISFC rates to 120 days while you're completing training. You would still, of course, have to be intent on completing training. If you do reach 120 days, you may need to do a corrective action plan to see, what needs to still be done and what can be done to help you complete training. But yeah, the short answer would be 120 days for the training period.
Thank you. The next question is, for an LOC 2 through 4 rate, can it ever be reduced while a child is in the same placement?
No, it cannot.
For this next question, does the LOCP apply to children in foster care who are eligible for regional center services or early Head Start, and or are dual agency children?
Dual agency children can be assessed by the LOCP. Kids above 3, it would most likely be more to get the dual agency rate. But for those 0 to 3, it might be advantageous for them to do the LOCP. So they are absolutely eligible. But the county would likely pick the higher rate.
Thank you. The next question is the county social worker or probation officer required to give a copy of the SOC 501 and explain the LOCP process to the resource parents before the LOCP assessment takes place?
It would be discussed when the LSCP determination is taking place. They should be sitting there with the matrix and scoring sheet in front with the resource family, because the resource family is who is providing the information based on the core domains in the matrix and you know how that's going to be scored. So that's when they could take a look at it together. I encourage though the resource families to ahead of time maybe go to one of our links at the end of this presentation to familiarize themselves a little bit more with the forms, but they would be doing them together with the social worker or probation officer during the determination.
Thank you. Let me just scroll up because there's quite a bit of questions. There's one question. Are resource parents still required to meet the training requirements if the child is placed in an FFA? Is the agency still required to be certified as an ISFC agency in order for the ISFC rate to apply?
As far as the FFA, if they are not an ISFC approved program, the agency can't approve the resource family as ISFC approved. They would need to have an ISFC program in order to do that. In theory, if otherwise eligible, the family only rate I mentioned before could apply. But in order to become an ISFC approved family, it would need to be through, the certification of an ISFC program.
Awesome, thank you. I do see in the chat, a lot of people are asking about the family resource reporting tool. I will also add that as a list of the materials that will be sent out at the end of this webinar. So I'll make sure that I do add that for you all. There's a question, are there different ISFC rates or is it just one rate for ISFC?
Just one rate.
Two.
One of the questions asked is if the resource family has to request the level of care. Every child should have one automatically. You can request one if you think things have changed, but they should get one automatically.
There's a question, how long are rates effective for, and does the child get reevaluated?
As Kelly said, there's 4 triggering events. So if they move, or the ISFC is lowered, or if the resource family thinks that it needs to be redone. So the rate would last theoretically forever until 21, if none of those things happened.
Thank you. There's another question. is there a process for a resource family to request an LOC evaluation? Is it done through email, or is there a specific division or department that they need to go through?
Unfortunately, that would be different in all 58 counties. So my suggestion would be just to start by asking your social worker. And hopefully they can point you to the process if it's different than just needing to ask. But we don't dictate that.
There's a question on the LOCP and dual rate and if they interact with each other.
Okay, again,
Yeah.
you would basically get the higher, whichever one was higher is what the county should be giving you. So they don't interact, they're two separate processes. But you know, you could pick and choose, or the county can pick and choose.
The last question that I see is, do youth in emergency placement get LOC?
No, that was on the list of placements that do not get it.
Awesome. So if you do have a question in the Q&A that didn't get answered during this webinar, I will make sure that I go through all of them and I will send it to the LOC team. So don't worry. It's not that we couldn't answer or we didn't answer. I'll make sure that I get it to them because some of them are probably a little bit more specific. So I'll make sure I get that to the LOC team. So for now, we will continue with the rest of the webinar. So here are some of the resources that went over in the webinar. All of the ACLs, they are all linked here for you with the name of the ACLs. So if you need to go back and reference, it should be fairly easy for you to go back and reference. But again, this will be given to you at the end of the webinar. We want to thank the LOC Care, the Level of Care Unit from the Foster Care Audits and Rates Branch for presenting for us today on the level of care. Kelly, Ty, John, thank you so much. Thank you also to Lori. If you have any questions regarding the webinar specifically for the LOC team, here is their email, loc@dss.ca.gov. And all of the questions that were in the chat that didn't get answered, I will make sure that I forward those over to them as well. Just some additional contacts for you guys that is important that you guys have is on this slide right here, as well as at the very bottom, you will see if you need the SOC 500, the SOC 501, also that resource family reporting tool that Lori talked about. I will link it, but just in case I missed your email, you can always email the LOC team inbox, or also you can get it at the University of California Davis Resource Barn as well.
With that, sorry to interrupt. That UC Davis Resource Barn, that has a lot of information on and old webinars and resources on the LOCP. So I really encourage each of you to check that website out. And that's updated quite a bit when we make an update to like the scoring sheet or add a webinar, ACLs, etc. But it's a really good space to have resources for you.
Thank you, Kelly. And as another reminder, for any of our caregivers who had foster youth placed with them between March 19th of 2020 to June 15th of 2021, you should have received the caregiver pandemic a stipend. If you have not, please reach out to cpapayments@dss.ca.gov and we will look into it for you. But it is a caregiver pandemic assistance stipend. So just want to remind everyone about that. If you don't know or you don't remember, just send an email to that cpapayments@dss.ca.gov and we will check it for you. We want to make sure everyone who was eligible for it gets it. And for the caregiver support webinar, this is our information right here. So if you have any questions regarding the caregiver support webinar, you can email us at caregiverwebinar@dss.ca.gov. I will also have the link to our website. And then here's our information for our unit, which is the Foster Caregiver Policy and Support Unit. And you can reach us at caregiversforyouth@dss.ca.gov. And again, we want to thank everybody for participating and attending our webinar. We greatly appreciate it and want to just remind everyone that at the end of this webinar, you will also get a post-webinar survey. Your feedback is greatly appreciated. So if you don't mind taking just a couple extra minutes to fill that out for us, we would greatly appreciate it. And just a reminder as well, anybody who is needing a certificate of attendance, you can email CAC, which I will make sure I get you all of that information in the post-webinar email. So thank you, everyone. Have a great day.
You all. Thank you guys for hosting.